Okay, our next speaker is Susan Hazel. Associate Professor Susan Hazel has worked in the School of Animal and Vet Sciences at the University of Adelaide since 2006. She's Program Director for the BSc Animal Behaviour and teaches a foundation course in animal behaviour, welfare and ethics, and a unique course in animal management. Susan has been on the Dog and Cat Management Board of South Australia since 2014 and is a member of the Animal Welfare Advisory Committee of South Australia and the RSPCA South Australia Board. She's published over 80 scientific articles and lives with a Labrador and a Maltese Terrier. Susan Hazel joins us to discuss a framework to enable a more collaborative approach to animal management.
Thank you. It's a great pleasure to be here, and I thank the organisers for giving me the opportunity to speak. I'm actually quite humbled by the fantastic presentations that we've had already and the work that the people in this room are doing. My head is exploding, so I will try and keep it together on the stage. But on the theme of breaking down barriers, I have lived with dogs all my life. I've been a vet for a long time. I've worked with animals for a long time. I've been working in animal management, which is the topic of my talk now. And I'm a bit of a big picture thinker. So when things aren't working, when you're trying to see the barriers and how you might cross them, I try and think of other ways to conceptualise, to think about them. And this is some of my thoughts in this talk, and I hope they make sense. They're a work in progress, and I would greatly appreciate any feedback that you have. If it makes sense, you've got suggestions to make it better, that would be fantastic. And some of it might apply to the US, some of it might be a little bit different, so it would be great to get your feedback as well. And I'd just like, before I begin, to acknowledge and pay our respects to the traditional custodians whose ancestral lands we gather on. We acknowledge the deep feelings of attachment and relationship of the traditional people to country, and we respect and value their past, present, and ongoing connection to the land and culture beliefs, and I'd extend that to any First Nations people in the room. So I'm going to start out with a definition, because I teach, but I also believe definitions are really important, that unless we agree on definitions, so animal welfare is a great example. So I've taught that since 2006, and people's definitions of animal welfare really vary, which is fine. There are different definitions. But when you don't understand that you might be talking about something different to the person next to you, then you might not understand why you disagree, or what's going wrong in the conversation, because you're actually talking about two different things. I have been teaching a course in animal management for 3 years now, and when I started bringing this together, I realised, actually I don't use a definition of animal management, and what would the definition be? Management means the coordination and administration of tasks to achieve a goal. So you might think, well, looking at AIM, the Australian Institute of Animal Management, that's an easier way of saying it, AIM, they might have a really good definition, and they kind of do, but obliquely. So they talk about local government professionals, so animal management officers, whose job is to maximise community health, safety and amenity by minimising the negative social, environmental and financial impacts of inappropriately managed animals. So one, it's not really a definition of what animal management is. And the other thing, and I know this has really changed, and there's the conversations in the room, there's a lot of things are really changing in this area now, but it's very much a deficit approach. So it's not talking about the benefits of that human-animal bond. So Charles Sturt Council do fantastic work in Adelaide, and if you look up their current animal management plan, they've got a fantastic vision. So to support pet owners, to create an environment where people and pets integrate safely and harmoniously. And I think that's a fantastic vision. And we're now looking at a more holistic approach where we're not just reducing the deficits, we're looking at the benefits. And so I've come up with a working definition, which is a bit clunky. So this is one area that I think is a work in progress. But I actually looked at a definition of wildlife management to come up with this. So animal management we might consider as the process influencing interactions among and between animals, and we're talking especially companion animals, human and natural and constructed environments and people to maximise benefits and minimise costs to all. It aims to balance the needs of animals with the needs of people and the environment using the best available evidence. So we're using a scientific approach, and it's very much an ecological model, so it's much wider than just looking at a fairly narrow and deficit-based approach. I have come to some of this, so I'll just tell you a little bit more about me as well in looking at this. So I am an academic. I have worked in practice as a vet, but I've been an academic longer. And so I very much look at evidence. I try and take as unbiased a view as I can. I know that we all have our biases. We try and at least acknowledge some of them we're not so conscious of. So I have that position. I don't work in practice, but I'm still part of the Australian Veterinary Association, and I'm very aware of the stresses that vets face in practice still. I'm on the RSPCA South Australia board, so I get the animal shelter perspective, and I'm on the Dog and Cat Management Board of South Australia. And wearing those different hats, depending on which meeting I'm at the time, we might be talking about something that we're trying to do. And you mentioned that other organisation, this would be really easy if they didn't do this or they didn't do that, and why can't they see? And because I'm in the room and I know the complexities of some of these arguments, there's not always an easy answer, they don't do this because. But when you're embedded in an organisation, you get to know why people aren't doing things. So that really brought me to this. And when we map out the organisations that might be involved in this bigger picture of animal management, so on the left you can see the different categories of organisations. So we have governmental organisations, we have our not-for-profits, and we have private businesses, and they're all working in the same space. So in South Australia, we have a Dog and Cat Management Board, which is the interface between the state government and local councils to enact the Dog and Cat Management Act of South Australia. We're a skills-based board, and we meet monthly and really look bigger picture at some of the things that we need to do. There are other governmental organisations that will also have some say. So when it comes to cats, for example, feral cats, there's conservation. There are other aspects. We have our shelters, and we have in private businesses, we have veterinary practices, we have dog trainers and groomers, we have our Pet Stocks, Pet Barn, all of those other organisations that work in the space. And then we have the pet owners. And I said my head was exploding a bit from everything I've learned in this. And I just looked at my slides earlier before I was ready to talk. And I realised, actually, this is a really incomplete diagram, because on the right, we should have all of those things that are impacting on the pet owners. So Sonia's fantastic presentation earlier about the social determinants, everything from that side is going to be impacting as well. So do we play in the same sandpit well, or don't we? And I'm guessing that most of you know the answer to this question, even before I go through some examples. So from the veterinary perspective, the veterinary profession, there's been a shortage of vets. It's a difficult job with a lot of compassion fatigue, and the profession has been struggling. And in New South Wales, the Australian Veterinary Association have been looking at different stresses, and they did a survey, 2022 I think it was, where they looked at what stray animals were brought to veterinary practices in New South Wales. And they found that 70% of vet practices receive 4 or more stray dogs per month, and some of these are smaller practices. But some of them are receiving 10, 15 or more stray animals every month that are coming to the practice. And they're not really equipped always to take them. So some quotes here: council does not have an on-call ranger and currently advises people to place strays back on the streets, which isn't a great option. So the vet gets caught between the owner, who's trying to do the right thing by an animal who's in need, and the council's not going to take them. So they can't really say to the person bringing it in, I'm just not going to take that stray dog, because then they get shouted at sometimes, people don't understand, so they take them in. And the second quote, the public think we are a government-run institution, can't grasp the concept that we have higher priorities and are short-staffed and have no place to take said animals. And of course, that animal that's coming there in need, there is no higher priority than that animal which is in need, and vets are there to help animals. But they might also be short-staffed, they've had a 14-hour day already, and it's just, they're in a difficult position. And it becomes even more difficult when you realise that they're not getting payment for it. So 80% of the practices that answered received no payment at all, and even when they did receive payment, 90% said it didn't cover the costs of taking in that animal. And again, some quotes, we cannot legally charge owners as we have no real right to hold their animal. So the law is really murky as far as what vets can and can't do, and they can't charge. And you can hear the indignation in that last quote. So not a cent, we even need to pay out council tip for burial of dead stray animals and wildlife. So it costs vet practices money, and they're not always in the position that they're financially able to bear all of those costs, and often they're short-staffed. The animal shelters, I think a lot of people in the room are aware of the stresses that animal shelters bear every day. There are shelters that are closing the door due to the financial constraints and the increase in the influx of animals. And it's a really difficult space to be working in now. So this conference is fantastic. I'm sure you're all enjoying it, to try and get some different perspectives and think about how we can do different things. As Jackie Rand put up in the quote, we don't want to keep trying to do the same things and we get the same result, which is it's not working. And finally, local government. So local government also has its constraints. So some dog pounds have been closing in local government due to lack of funding. And in South Australia, as an example, so the RSPCA has had to shut its doors and are only taking animals from councils that they have a contract to take animals for, because it's past their capacity to care. So there are actually few shelters that will take animals now, and local councils in the Adelaide area are really struggling to know they're not equipped with pounds, they're having to build pounds, and in really a quandary about what are they going to do with the animals. So everyone's struggling. So what can we do better? And this is where I came to an organisational typology approach. And you're probably thinking, what on earth is that? I also thought, what on earth is that? But I came across it through an email that I sent. So a Professor Mitchell, who's in the US, who had written a fantastic paper about public policy relating to animals. And it made so much sense. And I wrote to him, I've come across your articles while researching how vets, local councils and animal welfare rescue groups can better work together. They often end up working antagonistically, even though their goals overlap significantly. And I was delighted the next morning to open up my email and see a response. And he said, it's certainly an administrative zoo with so many service agencies and advocacy organisations across the globe occupying the same policy space. People keep creating new groups, associations to address animal problems instead of using the existing ones. It's a morass that wastes resources and impedes organisational effectiveness. So he then suggests the first step would be to use an organisational typology. And my first response was, what is that? I have no idea. So again, I went to definitions. Organisation, it can be an entity such as the RSPCA, but it can also be a verb which describes the process of determining, arranging, grouping and assigning activities to achieve objectives. And typology simply is a structure. So when we talk about an organisational typology, it's the structure of organisations in relation to their ability to achieve their objectives. And it can be looked at as a single organisation. So for example, you might look at decision making in a single organisation. Does it only happen at the top, or is there more a distributed decision making where people at the bottom can also make decisions? But you can also look at multiple organisations and how they work together. So for example, looking at public-private organisations, and you can look at whatever you want to, which is relevant to organisations achieving their objectives. So it might be their goals, it might be their funding sources, it might be other things. So using an organisational typology approach, we can map goals and objectives and this would include common interests and conflicts. We can also understand how people think about their organisation's role in animal management. And a lack of shared understanding of the goals really reduces our ability to get to where we want to go. This kind of approach has been used quite a lot in human public health. So, for example, looking at organisations working together in health prevention programs. And it always helps to get people on the same page, to be working towards the same objectives and to achieve their goals better. So, an example. So this is a fairly simplified table, but if we're talking traditional animal management and we're looking at dog attacks, from the perspective of a local council, they need to investigate dog attacks. It's part of their job. They need to protect public safety, and they will place control orders to protect public safety. From the perspective of veterinary clinics, they treat dogs with behaviour problems, including aggression, and at the extreme end of that, where public safety it's too risky, they might euthanize those animals. They treat the victims of dog attacks, and again, they do have some role in public safety, that they need to manage the dogs and make sure they're not unsafe. And then the animal welfare organisations rehome dogs with behaviour problems, and again, this might include euthanasia at the extreme end of that, and they also have a role in public safety. So you can see across that we're all working to the same goal, to reduce dog attacks or to manage them. The local councils are working at the outcome end, but if we look at those other areas, we're starting to look more at where we might prevent them. And local councils are also increasingly working in that prevention space rather than just reacting. When we look at unwanted animals, the local councils pick up stray animals, and depending on the state and where they are, they might also run a pound or a shelter. Veterinary clinics, as I've already stated, they're dealing more with stray animals. In South Australia, I'm guessing that vet clinics now are starting to deal with more stray animals as local councils don't have anywhere to take them and there's overflow. And animal welfare organisations will take in stray animals and rehome them. So again, all working in the same space. Even though if I'd asked different people here about, do you work in animal management, the animal management officers around the tables would have said, yeah, I do. But probably those of you that are working in other areas wouldn't have said, with a more restricted definition, that you worked in animal management, but you all are, and we all need to work together better. I think it's also really important to consider social determinants of health when we're talking about the prevention. So we need to look at bigger picture, which I didn't in that earlier slide, where I completely missed the side looking at all of those impacts on the pet owner or guardian. And this is where we start to move more into prevention. So stopping those animals coming to the shelter in the first place. I think it's also important to think about which viewpoint we're looking at. Are we looking individually? Are we looking population-wise? So this is a bit like the GP that looks at individual patients, and the public health professional that runs campaigns like Slip, Slop, Slap to look at population health. There's a lot of population health that I think we need to look at, and social determinants of health certainly look at that population-wide. But we need to focus in and out when we're looking at this. Sometimes we do need to look at the individual animals, and sometimes we need to look more at the population. We all have the same constraints, whatever organisations you're working in. We do not have enough staff, we don't have enough space, and we certainly don't have enough money to do all of the things that we would like to do, which makes it even more critical that we can work together. Together is certainly better, and there've been some really amazing talks just yesterday and today about how people are working collaboratively with the community and with other organisations and achieving so much more than you can by yourself. This is a recent example that I just saw in Scotland, where the Scottish Association for Mental Health, their healthcare workers that go out, they're now trained in animal welfare, so that if they go into a house and there are issues with the animals there, they know what to do. And the SPCA inspectors that go out and they're looking at the animals and the animal welfare, they're now being trained in mental health. so that then when they go in and there are problems with the people there, they know what to do. So I haven't given a magic bullet. I'm sorry, I would have loved to have stood up here and said, this is a really easy solution, let's do this, and things will become easier miraculously. And so this is not an easy way, but I think it's a way to take incremental steps with a longer term and more effective solution to some of the problems we have. So I do think we need to come up with a consensus definition of animal management to encompass all of the different work which is going on, because if we work in our silos and we have the barriers around us, then we're only working within our silos, and everything's happening around us which is still getting worse and worse, and we're not dealing with it. I think analysing the goals and work that each organisation does, and I think that's what Professor Mitchell was really intimating, that it would be the first step for us to work better together, would be to do that, and to take a whole of system approach with prevention. There are some things that we need to react to. When there are dog attacks, we need to react to those, we need to respond. But let's go back to the beginning problems. And I really hope that this will provide short and long-term solutions. And that is the Labrador. Guess which is the better behaved dog, the Labrador or the Maltese? If any of you have ever owned a Maltese, then you know the answer to that question.